Hey, it's Ray here with day 5 recovery, 4 days after surgery. I guess recovery day 4 is what would call it. Um, Still in pain, rough night, not easy to sleep. It's never really easy, and I'm off the Percocet now for good, so it's tough to find a comfortable spot with just naproxen or ibuprofen. But got through the night. Um, Developed a little skin irritation. The material of the Ultra Sling is sort of a neoprene uh, synthetic, and it's basically nylon, mostly synthetic. And my skin is reacting to it, so it gets hot. And where the elbow kind of folds, that's like the hottest point, and it gets irritated. So I'm trying to get it out of the sling as much as possible, which is good basically for occupational therapy wise. I mean, I'm able to this is my bad hand. I'm able to get it up here, and I was able to make a phone call and kind of bend forward and hold the phone, doing little things. I held a cup and I was able to take a sip with it. So I'm doing like little tiny motions, but still getting the arm up with the bicep. That's not too bad, but the rotation outward is really tough. So anything that requires me to reach over here is kind of out of the picture. It's just not happening. So I'm kind of resting occasionally on the sling for that foam, support. And I'm walking around the house just getting up with this as a support, but trying to keep my arm, for the sake of the elbow, the temperature, and the skin, keep it out, and then just leave it here, like resting on the armrest like that, so that I can keep it cool, keep the skin cool. Can't really go to sleep like that because I could, move it and jostle it and then hurt it. So for the moment, some complications. Sorry about the rear lighting like that. It's a little tricky to see. But for the moment, we're hitting a few snags. But basically, stronger today than yesterday is the short answer. My hand is good. I'm able to, like drumming wise, I'm pretty sure if I had sticks in my hand, I could just do light wrist motion. Feel a little bit in my shoulders with that motion from the wrist. But I'm sure I could do a trackball. It would tire out my shoulder. I was typing earlier, but even to place my hand here on the keyboard, as you'll see the laptop, like just to get my hand on that keyboard is a chore. I have to use the other arm to lift the bad arm onto the keyboard. And then I can type. So it's an uphill battle. My big goal is to be able to drive next week for my doctor's visit for my post-op. It's a week from today. So I'm just going to try to get to the point where I feel comfortable enough to head out and get in the car. And weather hasn't been great, so hoping for a nicer day tomorrow, and try to get out and maybe get a little exercise.